I'm Lindsay Condon. The Philadelphia Children's Hospital published Lydia's story in 2016. Lydia was participating in soccer camp in 2015 when she heard a pop in her right knee. She iced it and rested. She then went to the doctor to find out she tore her anterior cruciate ligament and meniscus. She would undergo surgery and physical therapy for 9 months. She got cleared, but not for long. Her first soccer game back, she heard a pop, this time in her left knee. She went to the doctor and found out she tore her anterior cruciate ligament and meniscus. This was heartbreaking news for Lydia because she knew that she couldn't risk another knee injury, so she had to quit soccer. Every one of you know someone who has had a sports-related injury. But what you don't always realize is the effects of overtraining athletes. First, I will discuss the problem of overtrained high school athletes. And second, I will discuss a possible solution. Let's begin by first talking about the problem of overtrained high school athletes. Reed Health wrote, "Signs of overtraining and overuse in young adults in February of 2020, explaining the overuse syndrome." Overuse syndrome is when the athlete is undergoing intense physical activity for long periods of time without adequate recovery. Athletes are being overused. Excessive training is decreasing performance. Avery Feinberg, a professor of the Department of Health, Exercise, and Health at the College of New Jersey, wrote, "Overtraining in young adults, how much is too much?" stating that 50% of all athletic injuries seen at the pediatric sports medicine clinics are related to overuse. Muscle and ligament tears may require surgery. 120,000 ACL tears happen yearly in the United States. Joe Breener, a sports medicine physician at the Children's Hospital of King's Daughters, wrote, "Sports specialization and intensive training in young adults" on September of 2016. Sports overtraining exists because of sports specialization. Sports specialization is when an athlete chooses to participate in one sport all year round. Athletes are usually doing this to succeed because they want to compete at the collegiate level or possibly professionally. 3.3 to 11.3% of athletes are participating at the National Collegiate Athletic Association level. 1% are receiving an athletic scholarship, and 0.03 to 0.5% of college athletes are participating professionally. Joe Breener's study says that 62 million students reported and 27% are specializing in one sport. Specialization in sports has negative effects. It can cause social problems, like the athlete may become detached from their peers and have struggled controlling their own life, relying too much on others. Overtraining athletes also cause harm. It causes a health concern. Athletes need a balanced diet to maintain growth. The diet should contain calcium, iron, and vitamin D. Excessive training mixed with a non-proper diet can increase stress factors and lower bone mass. It also has an increased rate of injury. Common injuries that occur because of overtraining are broken bones, joint sprains, muscle and ligament tears. 2.6 million athletes per year are needing emergency room care for athletic-related injuries. Another effect is fatigue. Athletes are getting illnesses because of fatigue, because of increased immune functions. It is also hindering their ability to concentrate in school. Now that I talked about the negative effects of overtraining athletes, let's talk about a possible solution. The American Academy of Pediatrics, too much too soon, overtraining can lead to injury and burnout on February 2020, recommends that students train up to 5 days a week with at least 1 day off of unorganized sports activity. They also recommend that students train less than their age and years. Overtraining the Minnesota State High School League is aware of the risks. According to the 2019 to 2020 Minnesota State High School League official handbook, there is a summer waiver period that includes a 1 week no contact period the week of July 4th. All Minnesota high school leagues are following this, but they are not regulating the practice times, duration, and intensity of the training. Cassie Dion, a lead physical therapist at the Tailored Training Fitness Center in Ontario, Canada, wrote Real and Present Dangers in Overtraining Young Athletes, How Much is Too Much, on July of 2019, explaining the importance that athletes need to be participating in a variety of sports. Variety of sports is increasing the student's skills, and it is decreasing burnout. Prevention of overtraining will decrease the amount of injuries, and preventable injuries will continue to occur if this problem does not get fixed. First, I talked about the problem of overtraining high school athletes, and second, I talked about a possible solution. The Minnesota State High School League must regulate training in high school athletes. After hearing about the problem of overtraining high school athletes, you will agree that the Minnesota State High School League needs to make a change. 1, 2, 3.